Meet Dr. Arambava, a pediatric endocrinologist at Royal Bali Hospital. His patients have to travel 3 to 4 hours to get to him, and he often loses those patients to follow up. His patients cannot monitor diabetes properly and so do not get adequate insulin. It's not just his patients, but 70% of the diabetic patients in Indonesia find it difficult to manage their illness. The problem for clinicians like him is that they need to track their patients' disease progression to make data-driven decisions to adjust the treatment to prevent major type 1 diabetes complications. That's where our solution comes in. We prototyped an app for doctors like him called GULA, which means sugar in Indonesian. Doctors are provided with a blockchain-enabled diabetes diary that they can register their patients on. The app is equipped with an AI chatbot giving them real-time feedback and insights on their current glucose level. It's also a platform enabled with telemedicine and provides patient educational videos. So Dr. Arambava now has the GULA app, which he can register his patients on, and they can download it on their smartphone and start logging their glucose measurements daily. The AI chatbot will be able to ask specific questions based on the symptoms being logged by the patient. The clinician is also able to set the target glucose level and dosage recommendation. If the glucose levels are higher than the target, the app will also give patients insulin dosage recommendations based on the guidelines that have been given by the physician. The next major component is enabling telemedicine, which would increase follow-up consultations. There'll also be educational videos that parents and kids can watch, like how to inject insulin and how to manage diabetes during Ramadan. We are a business-to-business company. We would approach pharmaceutical companies for partnership by demonstrating the effectiveness that managing diabetes can have. Our main purchasers of this app would be government institutions to supply the public hospitals and insurance companies for private hospitals. The annual cost of insulin for a patient is around $15,000. In comparison, an annual subscription to our app would be just $100 per patient. 1.1 million children in Indonesia have diabetes, which means that with just a 0.9% utilization, we can get 10,000 subscriptions to reach $1 million in revenue. This highlights just how sustainable this model would be and how large it can scale. In comparison to our top two competitors, we are the only comprehensive app that combines digital glucose monitoring and dosage recommendation, telemedicine, patient education videos, and a decentralized data storage system all in one app. In the long run, we are on a mission to use the power of the blockchain technology to create a national registry of patients to understand prevalence, disease control, and reasons for loss to follow-up. We are confident that the GULA app will empower the children of Indonesia to take control and manage their type 1 diabetes, thereby bringing back the GULA in their lives.